You are welcome to Vascular Dementia Part 1, the Masterclass in Psychiatry. I'm Dr. Prosper Tettey Doe, practicing psychiatrist in the United Kingdom. This is a very important topic in the clinical exams of the training of psychiatrists. And I'll give you a scenario, then I'll give you some of the points as to go about it. Now, you have been asked to assess an 80-year-old patient who had transient ischemic attack 2 days ago. Take a history to identify risk factors for dementia and current cognitive deficits. You may take notes and come to a diagnosis, as in the next station you will be meeting his wife. So in this case, do not do a cognitive assessment. That's the instruction. This station is a history-taking station, and it involves firstly establishing any cognitive impairment and the severity of the impairment. The next is to establish the type of dementia and specifically focusing on symptoms suggestive of vascular dementia. Also, get a wider history to identify risk factors for all types of dementia. Now, the risk factors for vascular dementia are as follows: high blood pressure, high cholesterol, diabetes, and heart rhythm problems, evidence of disease in arteries elsewhere, history of mild warning strokes like transient ischemic attack or what we call TIA, smoking, weight issues, elevated cholesterol levels, and family history of heart problems may also increase the risk of stroke, which increases the risk of vascular dementia. Mini strokes, sometimes referred to as transient ischemic attacks, are warning signs that a stroke may be imminent. Temporary loss of vision, speech, strength, or brief episodes of numbness may indicate a TIA. Rarer causes of vascular dementia are associated with autoimmune inflammatory diseases of the arteries such as lupus and temporal arteritis, which are treatable with drugs that suppress the immune system. So the outline here, we've talked about the risk factors. Now, behavioral signs and symptoms. Memory problems like forgetfulness, dizziness, leg or arm weakness, and lack of concentration, moving with rapid shuffling steps, loss of bladder or bowel control, slurred speech, language problem, abnormal behavior, wandering or getting lost in familiar surroundings, laughing or crying inappropriately, emotional incontinence, difficulty following instructions, problems handling money, presence of insight into the deterioration of cognitive function and physical health. The onset can be gradual or dramatic. A prolonged period of repeated TIAs leads to a gradual decline in memory, whereas a stroke can lead to an abrupt onset. Regardless of the rate of appearance, vascular dementia typically progresses in a stepwise fashion, where lapses in memory and reasoning abilities are followed by periods of stability only to give way to further decline. So stepwise decline. Now the next is 5 subtypes, which I'll mention. The first is 5 subtypes of vascular dementia. The first one is mild cognitive impairment. 2. Multi-infarct dementia. 3. Vascular dementia due to a strategic single infarct affecting the thalamus, the anterior cerebral artery, the parietal lobes, or the cingulate gyrus. 4. Vascular dementia due to hemorrhagic lesions, small vessel disease, which includes vascular dementia due to lacunar lesions and Binswanger's disease. And the 5th subtype of vascular dementia is the mixed Alzheimer's and vascular dementia. In the multi-infarct dementia, one would say that it is the second most common form of dementia after Alzheimer's disease in older adults. Multi-infarct dementia is the second most common form of dementia. Thank you for your attention, and remember to subscribe so you can get access to the next linked station on vascular dementia. I wish you all the best in your career. Bye.